What is the most infectious, most deadly disease a dog can get? In my professional opinion, it's parvo. Parvo, far and away. Canine Parvo virus is horrible. It's a non-envelope virus, and this thing is robust. It can live in the environment for months, if not years. And when it infects a dog, it goes into the intestinal tract, affects the developing juvenile, young intestinal cells, and it just obliterates them. It just kills all of them. And by doing that, it compromises the intestinal lining of the dog, in most cases puppies. And when it does that, the doggy feels horrible, they feel sick, and then you get transmigration, guys. It's never been about defeating the virus. It's about outlasting the virus. The virus is going to run through its process. The body is going to eliminate it. The cells in the intestinal tract are going to repopulate, and the doggy can live a normal, happy, healthy life. But the problem is, guys, we must survive the virus. That doggy needs to get fluids, antibiotics to prevent against secondary infection and sepsis, supportive care for nausea medicine, keeping food down, maybe a tube for the gut to help calories. Wait, there is one thing we can do to stop the virus, and that's monoclonal antibody therapy. A lot of people know it as the parvo cure. I would not call it a cure. I would call it something else. I would call it monoclonal antibody therapy. And all it is it's going in and it's making it so the virus is not near as deadly, not near as pathogenic, and it's just slowing things down a little bit so the veterinarian and the puppy can do supportive care and pull through this in a shorter time frame and with less significant damage and less likely to die from it. So we're going to do two things. We're going to do monoclonal antibody therapy with the parvo cure, and we're also going to do supportive care, fluids, antibiotics, nausea medicine, all kinds of things, maybe even plasma to help the doggy feel better. This is not going to be cheap. Even in Nebraska, where I am, a lot of clients are spending a couple $1,000s to pull their doggy through parvo. Now, of course, guys, you can do sub-Q fluids. That's great. You can do at-home care. That's great. But you know what's not great? Your chances of survival drop dramatically. If you can financially support it, going to the doctor, going to the veterinarian, and getting in hospitalization, in-house care, overnight care, basically making sure that we're keeping food down, the diarrhea is slowing, we're staying hydrated before we go home. Even if we're only doing it for a handful of days, giving that doggy the chance to get ahead hydration-wise and prevent sepsis and infection secondary to the virus, that's huge for the dog's overall well-being and chances for survival. Remember, the best thing you can do for a puppy is vaccinate them with the distemper parvo vaccine. It's a modified live and it works incredibly well. Most people are going to say you need 4 vaccines. The rule of thumb is 2 parvos after 12 weeks of age. If you're giving parvos before 12 weeks, maternal antibodies will block some of the response. If you're giving it afterwards, we're waiting for the puppy's body to really start producing a response. So really you have this trough at about 12 weeks where we're very, very susceptible to parvo. The goal is to give enough vaccines over 3 to 4 weeks, multiple times, either 3 to 4 rounds or 2 after 12, to give the puppy the best chance of having a beautiful immune system so they don't get sick from parvo. As always, guys, my name is Dan. I'm a veterinarian. Thanks for watching.